This video outlines how a medical provider can prepare a family with celiac disease for navigating a learning environment and setting up appropriate accommodations. Ahead, you'll see a series of role-play interactions between a medical provider, Dr. Jocelyn Sylvester from Boston Children's Hospital, and a patient family to help deepen your understanding of how to have these often difficult conversations. At the end of this video, participants will be able to write a diagnosis letter that explains celiac disease and its treatment, explain federal laws as they apply to children with celiac disease, and describe the process for a child with celiac disease to receive accommodations in a learning environment. Let's get started.
When I diagnose celiac disease, the first thing I do is explain what the illness is. I go through a little diagram demonstrating what happens in the intestine and the implications of the inflammatory process, how it not only affects nutrition and absorption, but has more widespread effects on the body. But I become aware of the fact that there's more that's needed. I turn to the child and I will explain, and to the parent of course, that they're entering into a new phase of this child's existence. That in the classroom, they are going to be different. They're going to be eating differently. They're going to not share the lunches. They are not going to necessarily be able to partake in the foods brought in to celebrate occasions. And they become isolated. They might be teased. So they need to be prepared that you, the medical provider, provide the first step for them to get these accommodations at school. Become their advocate.
Whether you're a pediatrician, gastroenterologist, nurse practitioner, dietitian, or another health professional managing a child with celiac disease, there are several steps to take to ensure the proper medical care within a learning environment.
You or a member of your team is likely the medical professional delivering the celiac diagnosis to the family. The time of initial diagnosis is when the conversation should begin about setting up accommodations for the child at school, daycare, or any other learning environments they attend. It's important that your first visit with the family after diagnosis also include a conversation about legal rights, reasonable accommodations, and how to navigate the celiac disease management plan. This discussion should include explaining why it's important to have a management plan in place. So why is it important?
Most children spend every weekday in a school or another type of learning environment where they are cared for by individuals outside of their family. Just as a family member would carefully manage a child's gluten-free diet in home, it's important that the institution the child attends manages the diet while exercising the same precautions to prevent a gluten exposure. While most schools have very good intentions of carefully accommodating a gluten-free diet, the only way to ensure appropriate measures are taken is to have a formal plan in place. This might be a 504 plan, a modified individual education plan, or another type of plan depending on the type of institution. Upon giving a celiac disease diagnosis and providing the traditional education on the disease and the gluten-free diet, you will need to provide education on how to approach the child's learning environment. You will always want to direct them to a copy of the 2020 Voluntary Recommendations for Managing Celiac Disease in Learning Environments.
Ask the family what type of learning environment their child attends. If they attend a public school or an institution that receives federal funding, they will need a 504 plan or a modified IEP. If they attend a private school or private daycare, they will need to ask the institution what type of management plan they provide.
So one of the things that we always have to think about with a gluten-free diet is that eating is something that happens at home, but also happens at other places, particularly for kids we worry about school. So, Peter, what type of school do you go to? Do you go to a private school or a public school?
Public school.
And do you eat lunch at school?
Yeah.
Yeah. And so eating lunch at school is something that we really like to have a plan for. And so fortunately, we've just worked to make a national recommendation for how schools can help you to make sure that you can get gluten-free lunch at school. One of the first steps is for your parents to help you by talking to the school about getting something called a 504 plan. And in our recommendations, we have some tips for your parents and for your school on what people need to know about celiac disease and what types of things you'll want to talk about in order to have a 504 plan that keeps you safe at school. So we'll send you that information. It's also available. We'll give you links so that you can go back to it online and the school can have access as well.
Explain federal laws and regulations as they apply to children with celiac disease in learning environments. This will help parents understand that their children are protected by several laws in the United States, because celiac disease substantially limits one or more major life activities, including eating, digestion, and immune function.
What is a 504 plan? That sounds a little legally complicated. I don't want to be that parent who feels like I'm suing the school so we can have gluten-free food. Can you explain that?
So 504 plan is really just the name we give for the documents we have for any kid who has a medical condition, which means that they have to think about how they manage that medical condition at school. So many children, those with food allergies, those with celiac disease, those with asthma, often have 504 plans. It's especially important because situations like field trips, often there's complications involved and it's important to think ahead. And so the 504 plan is a formal process where you meet with the school and you can talk to them about the types of activities going on in Peter's class and what types of things they need to be aware of and think about so that he can be safe following his gluten-free diet at school.
Like what types of things would they do to accommodate?
Often the most important thing is awareness, because if people don't know that he can't have gluten-free food, then sometimes somebody may bring cupcakes that are made out of gluten. And so if they know he has celiac disease, then they can arrange to have a gluten-free snack for him. Other times there might be arts and craft activities or baking activities that use gluten flour, which are things that would be best to be done with gluten-free flour. So making sure that people know in advance and can plan is often what's needed.
Provide the family with a diagnosis letter that details the date of diagnosis, symptoms that the child experiences upon gluten exposure, and basic details of managing a gluten-free diet. A sample diagnosis letter is available in the 2020 Voluntary Recommendations for Managing Celiac Disease in Learning Environments.
The school says that we need to provide documentation of the celiac diagnosis. What does that mean?
Yes, so in order to have the 504 plan process, the schools like to have a letter confirming the diagnosis of celiac disease and outlining to them sort of the basics on what's required. It's something that I'll provide for you, and then you can forward it to your school.
Discuss accommodations that the child may need with the family. For example, if the child's primary symptom of a gluten exposure is vomiting or diarrhea, ensure that a defined accommodation is unrestricted access to the bathroom.
How do we know what to ask for? How do we know what to ask the school?
Well, I think one of the things to think about is what happens to Peter when he gets gluten.
Well, about an hour after we eat gluten, we are vomiting, and he hates the feeling of throwing up. And it's something that also leads to some anxiety in that it's hard to get him to eat again after that happens because he just really, really is so miserable when it happens.
And most kids don't want to vomit and will do everything to avoid vomiting again. I think it's important to think about, okay, so what if he gets exposed to gluten at school? School should know that if he has gluten, he might be vomiting, and there should be an accommodation for him to be able to go to the school nurse. He should be allowed to call you if he needs to. I think those are the sorts of things you want to think about in the plan.
His school also has Pizza Friday, and I know that he's very sad if he can't eat the pizza with his friends. Are we allowed to ask the school for gluten-free pizza?
When you're thinking about what things to ask for, it's important to think about these sort of routine activities that can involve food and celebrations, and Pizza Friday is a big one at school. So I would work with the school to see if they can find a gluten-free option. Some schools actually have caterers that are able to provide gluten-free. Other schools order in which case you want to work with them to identify a pizza company that makes gluten-free crust and that you trust that they're making the crust in a gluten-free way, and the school knows how to work with the company to get a suitably gluten-free pizza. So I'd work with the school and with the pizza company that you trust to try and work out a plan.
Be available to educate the learning environment. School nurses, health aides, psychologists, and social workers within the institution may need support as they learn how to medically manage a child with celiac disease. As a medical provider, you are well equipped to provide this education. Make yourself available to answer questions, lead a training session, or refer the institutions to this training program.
Review the accommodation plan as requested by the patient family. Once the plan is developed, many families will ask their medical provider for feedback and to sign off that the plan has been medically reviewed. If your patient family asks you to do this, please do so there's no delay in the plan being put into effect.
Help families troubleshoot when errors or issues occur. No learning environment, no matter how hard they try, is perfect, and it's important to anticipate that mistakes will happen. Be prepared to support patient families when the child is exposed to gluten or experiences other difficulties such as being excluded from an activity or subjected to bullying. Have a list of psychologists, social workers, or community education specialists available to be an advocate for these families when these mistakes happen.
So we had this incident in which we were on a field trip. I think we accidentally got the dairy-free lunch instead of the gluten-free lunch, and we were gluten. And he was so sick. I just don't know how to handle those type of situations.
So I think the most important thing to remember is that even when you do your very best to try and avoid gluten, sometimes gluten will find you and you'll get glutened. And so use this as a learning experience to think about what we can do the next time to try and avoid that happening. And just like parenting, you strive to be perfect, but there's definitely some moments you're not proud of. And it's the same for schools when they're trying to provide a gluten-free diet. So some of the things to think about are, can there be a designated person who's responsible for making sure that the gluten-free food gets to the person who needs the gluten-free food? Often families will have a parent accompany on the field trip just because it helps them feel confident that the gluten-free food is going to be appropriate. Sometimes children will bring their own food on the field trip because that makes them feel more comfortable. I think what's really important for Peter is that he learned that there's people at school that he can trust to give him food that's safe, because he's going to be going to school every day, and it's important that he is able to eat there and feel comfortable, and that eating doesn't make him anxious.
Educate referring pediatricians and others within your local healthcare network about celiac disease and accommodations for children in learning environments. As always, the more education that gets into your community, the better. As a medical professional, you are the frontline resource for helping a family diagnosed with celiac disease navigate the school environment. We so appreciate you taking the time to learn how you can support these families and the learning institutions their children attend to ensure a safe, productive, and fulfilling school year.